From the beautiful Sunshine State, the American Diabetes Association is bringing together the world's leading physicians, scientists, and healthcare professionals for the ADA's 84th Scientific Sessions. And ADA TV is here covering every angle. Welcome to the Orange County Convention Center and to the 84th Scientific Sessions. I'm your host, Autria Godfrey. All week, we'll be bringing you the very latest in diabetes research and care and introducing you to those working tirelessly to treat diabetes.
I really hope that people walk away feeling inspired, energized, and hopefully with some grand ideas of their next project.
We get started today with Dr. Alice Cheng, who will be highlighting the must-see sessions happening in the week ahead.
When people come to this meeting, they get to learn in their field, share their research, learn other research, and really understand the big picture as well.
Plus, we sit down with a member of the ADA's executive leadership team to hear about the endless scientific offerings at this year's gathering.
I really hope to advance knowledge such that the kids that I care for in my clinic have the same access that my kids have.
And all week, we are highlighting the incredible institutions and organizations breaking new ground in diabetes research and patient care. We get started on this first day with a trip to the American College of Diabetology. As diabetes becomes more common, a majority of patients find themselves without access to an endocrinologist and depend upon their primary care physicians for treatment, many of whom feel undertrained in diabetes management and care. Take a look at how the American College of Diabetology is addressing this gap.
The American College of Diabetology is a new organization focused on helping better train the primary care workforce and those who are passionate about diabetes to provide excellence in care for patients with diabetes.
The American College of Diabetology is a nonprofit organization whose goal is to help meet the needs of America for diabetologists. We help certify the diabetes fellowships, make sure that they're well run and they have every component you need for your training. And we also provide a board exam.
So in the past 2 years, we have already doubled the number of diabetes fellowship programs. We plan to continue to grow this to be all diabetes team members. And we want patients to know that they have a place where they can go, where they can count on excellence in diabetes care, and that they are able to seek those patients out in their communities where they have the need.
Turning now to the Lone Star State, Texas A&M University is making it a priority to meet people where they are through mobile health programs in South Texas, an area with a high prevalence of diabetes. Take a look.
Healthy South Texas is a partnership between the Texas A&M University Health Science Center and Texas A&M AgriLife Extension Service to bring health education, resources, and services to a 27-county region. The Texas A&M University system saw the opportunity to bring our two partners together to address chronic diseases like diabetes. And since 2015, the Texas legislature has supported this unique community-based model that has reached thousands of people.
Our program helps individuals help make better food choices, also to move more, be physically active, as well as self-monitoring. We have a team of individuals that consist of certified diabetes educators, nurses, dietitians, community health workers that work together to help these individuals make lifestyle changes.
As we kick things off, we know that you are eager to network with colleagues, hear the latest scientific advances and groundbreaking research presentations. Here now is Dr. Marlon Pragnell with a look at what's in store. Thanks for your time today.
Thanks so much.
All right, I want to get started with something very simple. What are you most looking forward to in the next 4 days?
Gosh, it's going to be amazing 4 days. I'm looking forward to all the great research on obesity. We're going to see a lot of stuff there, a lot of beyond obesity, all the benefits of these GLP-1 drugs for kidney, cardiovascular, sleep apnea, and so on. AI, that's going to be very interesting. A lot of science research on tech. Diabetes technology. So those are kind of the main things I'm looking forward to. And also I'm looking forward to people coming together to kind of connect, learn, and because this is where all the great ideas come together, right, and people kind of create, and this is the staging point for the future of diabetes research. And you have some incredible plenary sessions. Anything in particular you'd like to highlight? Yeah, we have 4 plenaries. The first one is going to be the opening welcome plenary. It's going to feature Dr. Robert Califf, who is our FDA commissioner. On the next day, on the Saturday, we're going to have our CEO, Chuck Henderson, give a nice fireside chat. And then not to be missed, on the Monday, we have the Outstanding Scientific Achievement Award presentation by Dr. Stephen Parker. And then also the Banting Award, Lifetime Achievement Award, Banting Award, to Dr. Rory Holman. So those are going to be very exciting, so please enjoy. One thing I want to highlight is that the Innovation Challenge is back this year. Can you talk a little about what the feedback was during last year's rollout and what you're looking forward to with that? Highly talked about. Yeah, I know, it was great. So the Innovation Challenge brings together these startup companies that are interested in kind of solving everyday problems that people with diabetes have and experience and so across the whole broad spectrum. So these companies kind of submit their cool ideas, innovative ideas, and we had a very good response this year. The top 5 get to come on stage and present in front of all the experts. I mean, this is the world's experts in diabetes, right? Yeah. And also in front of these expert judges. They get to pitch their ideas for 5 minutes. Then the judges will ask them questions for 5 minutes. And then what will happen is both the judges and the audience will vote and see who was the winner. And so we're looking forward to that. So much pressure. Yeah. So incredible. Well, that's coming up this week. Wonderful. Well, thank you so much for your time, and thank you for all of the work that's gone into the planning for these 4 days. We appreciate it. Thanks so much, Autria. The DREAM research team in Manitoba is a translational team focused on improving wellness for children living with diabetes. As Manitoba has some of the highest rates of type 2 diabetes in the world, First Nation children are at a high risk in Canada. Take a look at their work utilizing clinical cohorts and state-of-the-art lab techniques.
In Manitoba, we have amongst the highest rates of youth onset type 2 diabetes in the world. It breaks my heart to see kids and families in my clinic that are impacted. Not only themselves, but their parents, their grandparents are impacted. It's an intergenerational disease.
We have 4 communities that we represent in northern Manitoba. We're approximately 600 kilometers north of Winnipeg. That sort of impacts the quality of health services and access to health services for our community members. And we have 1 store in each community.
We know the impacts of colonization have impacted the health of these communities. And in order to sort of go back to some of those traditional ways of knowing and being and improving care with the kids, we spent a lot of time with community building programs in partnership, which allows them to also have some control, some autonomy over the health of their community.
The philosophy of the scientific sessions is to present cutting-edge research or opinion that is not heard in other meetings throughout the year. Dr. Alice Cheng, chair of the planning committee, is here in studio now to discuss how her team has done just that for this year's gathering. Thanks for your time today.
Thanks for having me.
So you have a tall task. Your committee is responsible for developing challenging and exciting program content that really reaches across diverse disciplines. How have you worked together with your team to do that this year?
So the very first thing we need to do is, and I think of it kind of like the Avengers, we try our best to assemble the Avengers of diabetes. So trying to identify leading experts that cover 8 theme areas, which have about 25 content areas within them, in order to lead those particular sections. And then sort of late summer, early fall, we ask them to assemble subcommittees where they create the proposals for, be it debates or panels or symposia on their specific content area. And then after doing that, we then come together as a larger committee in the fall and hash it all out. Now, one of the asks that we have of the subcommittees as they create proposals is to come up with hot topics and important subject matters, but also to come up with potential speakers. And with that in mind, we try to be as diverse as possible and sort of cast a very wide net in order to capture all the incredible talent that's out there. But that coming together meeting in the fall is a very intense weekend where there is a lot of discussion, a lot of collaboration, negotiation, but it's critical because we sort of see where everyone's coming from and try to pick topics that will be of interest to a very diverse audience. And then there's the jigsaw puzzle of actually assembling it so that it fits within the time span of the conference, not to mention all the abstracts and the many abstract reviewers, and then the ADA staff that really does a lot of heavy lifting. So I have tremendous thanks and gratitude to the entire committee for the huge job of making this conference come to life.
Right, I can't imagine trying to take all of those ideas and all of that content and whittle it down into something that's digestible over 4 days.
Yeah, there's a lot of negotiation and thinking.
Okay, so now that we are here, what are some of the key offerings that you're excited about for attendees this year?
So there's going to be over 200 sessions, hundreds and hundreds of abstracts that will obviously be available, as well as posters that people can take a look at. And then we're bringing back, of course, debates and panels, which people are very much excited about, and ask the expert type sessions. But as per usual, there's also going to be first in world readouts of some exciting clinical trials. Right. So just to name a bunch of acronyms, and then people can look up and see what they're specifically about. But there's the LENS trial that we'll be reading out, TIGHT, the names are great, eh? Mm-hmm. LENS, TIGHT, ATTEMPT, there's CATALYST as well. And then we're also going to hear about SURMOUNT OSA. Okay. We're also going to see some newer data from trials that have already read out in terms of their primary outcomes, but we'll see newer data from STEP-HFpEF and STEP-HFpEF-DM, as well as from SELECT, and as well as from FLOW. So these are just some acronyms of trials that we're going to be excited to hear about. But in addition, we're going to see some guidance documents that I think will be critical, such as management of hyperglycemic crises in diabetes, as well as one there's a lot of excitement around is how to monitor when we're looking at early stage type 1 diabetes. So there's lots and lots of cool stuff that people can look forward to.
Something for everyone.
Absolutely.
Definitely. So for you personally, any session that you are most looking forward to, or any topic that's going to be debated or discussed?
Yeah, that's a tough one because there's over 200 to choose from. But
it's like picking a favorite child.
Right? Seriously, like you really can. And I kind of wish I could clone myself. Mm-hmm. But if I had to pick one, I think the one that I would pick is Saturday at 3:15. There's going to be a panel discussion on a very hot clinical topic, which is looking at GLP-1 plus or minus GIP receptor agonists in the perioperative setting. To stop or not to stop. And this has become a very hot topic in the past year or so because of some guidelines coming out from other societies that have suggested stopping, and then another one suggesting not stopping, and then we're kind of stuck with what do we do. Right. And then of course the people we serve, the patients, are also stuck in the middle. So I really look forward to this panel, which I assume is going to be a very collaborative one where we'll learn from other specialties and try to come up with, okay, well, what do I do, next week when I get back to the clinic, and what do we advise?
Yeah, how can I implement this?
Exactly.
Wonderful. Well, I know your committee has worked so hard, as have you, on putting this entire week together. So thank you for all of your work, and thank you for your time today.
Thank you.
The University Hospital's Diabetes and Metabolic Care Center isn't just a treatment center, it's a story of resilience in action. The center's commitment to progress extends to research by focusing on population health and the local impacts of our healthcare system. Let's see how the center drives patient outcomes by better understanding the environment they're in.
When I decided to move to University Hospital, it was about building a new diabetes center. That allowed me to revisit how to reshape the models we have today to take care of patients, because current model is failing.
We try to tackle obesity in a multidisciplinary approach. I'm finding that patients are ultimately improving their quality of life as well as their medical problems.
Fundamentally, it's all about building trust, building self-efficacy, and building hope. And we are going to change the world when we see the humanity and the love in every human being, and then leverage that to make care better for the patients that we're so blessed to serve.
Whether you're a healthcare provider or someone living with diabetes, the Health Extension for Diabetes program at Clemson is empowering individuals with vital knowledge and transforming the effectiveness of diabetes management.
The Health Extension for Diabetes program is an American Diabetes Association practice-tested support program.
Health Extension for Diabetes is a novel approach, and we have a formalized partnership with diabetes self-management, education, and support programs that are ADA recognized.
The best part of working with HED participants and helping them with their diabetes journey is empowering them with information that's provided at the monitoring and medication session, so they could take that information to their next medical appointment and have meaningful conversations with their provider.
We've seen weight decreases. We've seen decreases in A1C, just very important for people living with diabetes. We've seen significant increases in clients' knowledge about diabetes and chronic conditions. We know that if clients have better knowledge about their conditions, they're better able to manage their diabetes. We've kept folks out of the hospital, and we have a goal to decrease healthcare costs associated with diabetes.
That's a wrap on day one of ADA TV. From the 84th Scientific Sessions in Orlando, we hope you've enjoyed this specially curated content and a look ahead at all the exciting things still to come this week. Remember, if you missed any part of today's episode, there are plenty of ways to catch up. You can always find the latest ADA TV episode on our TVs placed throughout the Convention Center, on the in-house channels at several of our partner hotels, on the shuttle buses to and from the venue, on the ADA's Scientific Session website, and on our X and YouTube pages. Thanks again for joining us here today. We will see you right back here tomorrow. From all of us at ADA TV, go have a great day.